Yes, so it's my great pleasure today to introduce Samo Kobti to everyone. Samo is a graduate of our university. She's graduated with a Bachelor of Medical Science and majored in Anatomy and Physiology. She also did go on to do further studies with other university, which I will leave with Samo to talk about more. So she commenced her career as an intern through our Jobs Off Campus program a few years ago. So she applied through Career Hub, which is really exciting. And from there, she progressed her career by applying to a couple of different positions, working in multiple hospitals here in Sydney, and then being open to opportunities. She has now landed herself in a manager's position out in Canberra. So she's a sleep laboratory manager at the Canberra Sleep Clinic. So welcome, Samo. Thank you very much for joining us today. And thank you for being able to reschedule. I know you had some personal matters to deal with last time. So thank you for joining us today. And we can't wait to hear about your career journey.
Well, thank you, Perrine, and hi to everybody. Hope you're all doing really well. I guess before we move on, please do feel free to ask me any questions throughout the whole session. I'm very happy to answer. As Perrine said, my name is Samo and I am the Sleep Laboratory Manager at Canberra Sleep Clinic. Well, I guess what I can tell you is I was a student to begin with, and I did apply for the respiratory technician position through Career Hub. After applying, I got the job. So for 6 months, I was doing being a respiratory technician. Basically, responsibilities were testing patients of all sorts for lung function diseases. So lung diseases, asthmatics, emphysema, and so much more. I'd done that for 6 months, and that was in a private. So I'd done that at Nepean Lung and Sleep. Not sure if you've heard of it. After doing that for 6 months, in a private setting, you can actually move from one position to another without a qualification. So you actually learn from scratch. And I moved from a respiratory technician to a sleep technician. And I learned everything from scratch. So really by the books. I've done sleep technician for about 1.5 years on my own. I was doing day duties and night duties as well. And we were a 24-hour operation. So I did do the night shifts plus the day shifts. So a little bit of both. After doing that for 1.5 years, I moved on to, I've started applying to hospitals. So I wanted to get a government job for some experience. So I've had 1.5 years of really solid experience, plus with my qualifications, I was qualified, started applying to all across hospitals, and I got back 2 in return. So I got a sleep technician job at Liverpool Hospital, and I got a respiratory scientist job at Westmead. So I was doing both. I was being part-time at both hospitals. Yes, I was traveling far, but it was definitely worth it. I was doing lung function, and we were doing arterial blood gases and 6-minute walks at Westmead, and we were monitoring sleep disorders for patients overnight as well. So we were also using CPAP therapy, which is part of our treatment. So I've done that for about a good 2 to 3 years, 2 years at Liverpool and 3 years at Westmead. It doesn't stop there. In the meantime, I was also working for a private clinic at Bella Vista. So doctor's name was Dr. Patel. Not sure if you've heard of him, but he works at Westmead and he's got his own clinic. And I was a respiratory and sleep a scientist. So I was basically the right-hand side of the doctor, the right hand of the doctor, doing everything. So lung function testing, sleep testing, setting up patients, and analysis of the sleep studies, analysis of the respiratory studies, reporting them, and doctor just signs off. It was also training new employees because it was getting bigger and bigger. For one-person jobs, it was a bit too much. So I started bringing in more employees and was training them from scratch. And I guess after doing that for a while, I also started doing my master's. So I did keep going with my qualification, and in my mind, I had a goal, and I knew that I did want to manage a lab. Now, don't worry if you don't know what you want to do right now, because you won't know until you start your experiences. I didn't really know that there was such thing as a sleep scientist to begin with, or even the sleep medicine industry. So I guess what I started doing is I started looking at my options, like, yep, I will go ahead and do further so we can open my doors for opportunities later on in the future for a better position. And I did. And I went in for the Masters of Sleep Medicine at the University of Sydney and was doing that for online. And that worked fine, working full-time, studying part-time. And as soon as I completed my master's degree, I started scrolling through Seek, as everyone would, and I saw a sleep laboratory manager position in Canberra. And mind you, this was all me in Sydney. I was in Sydney back then. I looked at it, looked at the criteria, looked at the qualifications, like, yep, tick the boxes. I was like, let me just apply. So you leave your door, always leave your doors open for opportunities, ladies. It is very important. You never know where you can be in 5 years' time. Did that, applied one night, and next morning I got an email, and that is when it all started. So got an email, was very interested, had an interview. So I flew from Sydney to Canberra for an interview, had the interview with the general manager, Cheryl, and the director, Stuart Miller, who's the director of Canberra Sleep Clinic, and got offered the job straight away. And at that time, as soon as I got the job, I was doing my exams for my master's. So I didn't even finish my master's yet. I was in completion. So there's always possibilities. And then I came to Canberra July last year. So I've been here for a year and a month now, and I will recommend it. Do not regret it at all. If anything, it's opened my doors more for the future, progress in my career. I've had encounters with colleagues from all over, different kinds of skills. I guess also what I can say is working in the science industry, it's not male dominated, I would say. It's a little bit of both. I can say doctors, yeah, definitely male dominated, but it's always a surprise when someone sees a manager who's a female and young as well, and it's like red flags. But I guess no. So I guess in the sleep field, in medical in general, I believe it's a 50-50 when it comes to the males and females. And I guess a little bit of advice as well. Always keep your eye out for opportunities through Career Hub. Keep your doors open. You may not know what you want to do now, but you will know when you start experiencing. You might like the first job you got. You might not like the first 5. You might like the 6th job. Keep and do not lose hope. Keep going. You will find what you're interested in, and you will find what your passion is at the end, I would say. I guess what I can also say is when you start working full-time, you are an adult, basically. Okay, so goodbye with teenager, goodbye being young, welcome to the adult life. And it's not going to be all butterflies and rainbows. You're going to go through a lot of experiences, good experiences that will increase your strength, and that will, you will grow as a person. And you've got those that some may get on your nerves and whatnot, but this is all part of your experiences. You will come across a lot of colleagues that you will love. You will come across a lot of colleagues that you may not love. You'll come across colleagues where you can say good morning to. You could come across colleagues where you won't be able to say good morning to. Same thing with bosses. You might like your bosses, you might not like your bosses, but what I can say is if you don't like something in your workplace, do not take the easy way out and just leave, because that is in your advantage of having that experience in your resume. Believe me, been there, done that. Don't give up unless there's a better opportunity on the other side. I would definitely give that to you. And look, there were so many challenges along the way. I guess just being an employee before, I guess just challenges were like, you don't get along with colleagues, you don't get along with your bosses. I think it just stopped there, really. And when, you know, you deal with difficult patients, those are probably the top three of being an employee. But as soon as I took over the management position, oh my challenges was just increased by the day. Now it is difficult, but I guess if you have a passion, you can always find a way. I guess some of my challenges, I guess the main challenge I had when I first started working at Canberra Sleep Clinic is that I was very young. Really, my age. It was my age, the fact that I look young too really gave it away. How was it challenging? Well, let's just say I manage a team of 24, so I've got a team of sleep technicians, I've got sleep analysts, and I've got a clinical support staff, and then me. So I'm really overseeing the whole team. And the challenge came is because I'm actually the youngest in the team, so that was a big pushback. So basically, all I want you to just imagine you trying to delegate duties or tell someone your grandma's age what to do. Just picture that. Have a picture, and it's not easy. It is not easy. It is very, very, very difficult. But I guess when you come, as soon as you step into your work, you have to be very, very professional and leave your personal life behind you and be very professional. So really, the staff should be looking at you because you're the manager, like the position really, rather than, you know, the person that you are in your personal life. So another advice that comes out of this is it's very important to separate your personal life from your work life. I can't stress how important that is. And of course you can have friends and stuff if they're on the same level, no problem. But I guess another thing I would say is be friendly, but don't be friends is very important as well. Then otherwise, you know, obviously conflict would arise. But I guess, yeah, so that was my big challenge, was to try and tell someone my grandma's age what to do. But I passed that. Okay, I definitely passed that. And what you learn is emotional intelligence. Every staff is different. So you have to cater the way you approach, or the way I approach each staff member in a different way. And yeah, you have to be creative. There's strategies you got to think about. Oh, I think about every day, even when I'm sleeping, I'm dreaming about strategy of what I'm going to do the next day, or how I'm going to approach a situation. Challenges like performance management. Oh man, performance management is the hardest thing. That's another challenge. Trying to, you know, let someone go is not easy. But again, this is where emotional intelligence come in, and I guess how you overcome this. Time definitely 100%, but also you've got to know the person. You've got to know the strengths and the weaknesses of each employee, and according to the weaknesses is how you approach your staff. So for one, you know, say for example, I've got a staff who's very, very, very emotional. She uses her emotion for everything in the workplace, and if I would need to approach her, I wouldn't approach her having like a statistical mind or anything really. I would talk to her with a little bit of emotion, and that will get to her, and that will give her the, you know, the picture. If I was to talk to somebody, say I was trying to do a performance management to somebody who doesn't have a creative mind, who emotions are zero emotional intelligence, and even verbally it's not going to get anywhere, but say that person is very got a statistical mindset, I will basically get out statistics of results of his work and show that to him, and that's how he would, you know, he would understand. And definitely that's how you get to the core of each staff. So you do have to know each of them. I guess as well, like as soon as I first started, I had a one-on-one conversation and discussion with each and every one of them, trying to get to know them. you know, and then you start thinking of ways of, okay, how you can help them, how you can approach each of them. So yeah, that was a big challenge for me, definitely. And I guess another thing that really helped me is I'm currently completing a diploma of leadership and management. So if you ever want to go into the management role, I will recommend it. You learn a lot of things that you wouldn't even think about. So that is that will be a benefit for you, and definitely an advantage for your resume. I guess another thing as well as a challenge, I must say, is trying to like delegate certain duties to staff. So I can't delegate like an admin role for someone who's not really good at admin tasks. I can't give somebody, I can't give an analyst, for example, an analyst is the staff members who are actually analyzing sleep studies. I can't give her billing. Everyone knows, you know, when you go to doctors, you bill everyone bills. I can't give that to her and expect her to know. Everybody's got their strengths. So depending on their strengths is what the duties I usually delegate equally amongst. And training can take a lot of your time. It can consume a lot of your time as well. Day-to-day work. Okay, so what I can say as well is the employees I've got, for example. So let's talk about the 3 different sectors. I've got a clinical support staff. So what their operational duties on a day-to-day basis are basically working very closely with doctors, booking sleep studies, taking payments for sleep studies, explaining options of whether they want to do privately or use their private health insurance. We run CPAP clinics as well. So CPAP clinics is a treatment for sleep apnea. So we run the therapy for them. We do mask fitting, different kinds of masks, but I'm not sure if you guys have seen it, but we've got different kinds of masks that we put on patients as well. We do that part of the role. I guess another thing as well would be doing some downloads to look at patients' usage and compliance. So that's what's really important for a clinical staff role. For a sleep technician's role, what they do is they set up patients. They've got leads on the head, on their faces, over their body, and each lead measures different parameters. So we've got the brain waves, you've got the eye movements, the muscle tone, you've got the breathing efforts, the leg movements, the apneas. So these are very important. So they set up patients, they do mask fitting as well, and they monitor them. So they look at the screen, they monitor, they look at the brain waves. So we teach them prior to them starting on how to read brain waves, how to know if patients are awake or asleep, because that's very, very important in the sleep field, especially if you're titrating a patient. And then they monitor them overnight. And there's 2 different types of studies. I think the main ones are the diagnostic studies, and that's basically just telling us, really, does the patient have sleep apnea, yes or no? And if yes, the severity. The second one would be the treatment. So that's where we actually titrate the patient. So we have the mask on and you've got pressurized air coming through. A lot of patients think it's oxygen, but no, it's not oxygen. It's just pressurized air to keep the airways open. Just a little bit of education on that. And I guess the timing is 24/7. A sleep lab is open on 24/7 basis as well. So a clinical support staff, they do a 9 to 5 or like an 8 to 4. Sleep techs, they've got, it can go from 6 p.m. all the way to the next morning at 7 a.m. I've got a lot of technicians who do 12 hours straight. I've got a lot of technicians who only do setups, who only do overnights. It really depends. And ladies, I guess another thing what I can say is if you ever see a sleep technician job, which I have seen, I think, if not mistaken, Nepean Lung and Sleep was hiring sleep technicians, so please do have a look at that. It is really good with your studies, because you can do assignments and even study during your overnight shift. It's possible. I've done that. We all the sleep techs have actually done that. So definitely keep your eye on that. in analysis. So our analyst team, what they do is when patients do a sleep study, we record it. So we use Nexus as our program. We record the patient's sleep study. And the analysts come in the next day. They'll open up the program and they will score it. So basically what I mean by scoring is they look at the breathing and they look at the brain waves. And then they, at the end of the report, it would say whether they've got sleep apnea, yes or no. Depending on that, our clinical staff will start booking their follow-up appointment and etc. Or just keep going. So we are with the patient from the very beginning to the very, very end as well. So those are the three main sections that I look after basically.
I guess I do have a question with the whole pandemic that we're going through and the virus being, I guess, the respiratory virus. How has this affected your day-to-day work? How has it affected the way that the clinic runs? Are there any measures that you guys had to put in place, or did you have to shut down? Like, how does it work being like a
that's actually a very good question, because we are one of the lucky ones that we did not shut down, but we limited our sleep studies. So basically we ceased all the titrations and the diagnostic sleep studies for a good 4 weeks, I must say. Yeah, that's not good business-wise, but the COVID cases in the ACT were high at that time. But as soon as the cases went down, it was a bit more controlled. Then we were able to open up only diagnostics, but we still had to cease titrations. Why titrations? Is because patients, when they pop in the mask and it's got like a little tube that's connected to the CPAP machine, when you turn it on, it's actually air coming through. And as you all know, with COVID, the aerolization risk is actually very high with titrations. So we had to cease titrations, but we were still doing the normal diagnostic, which is the first step. I guess in regards to operational day-to-day basis and staff, that was a very difficult time. We did have to stand down a lot of our staff due to no sleep studies, due to no work, really. At one point, it was only the management team that were on their feet 5 days a week. But I guess once we started up again, got in contact to the staff, and the ones who haven't already found a job came back, and that's when I started recruiting a new team. And that's where training starts from scratch. I guess the sleep tech is always casual, or majority of the time it's casual, so the turnover for staffing is actually very high. But and the measures that we took is the same as we follow the ACT government, the government advice. So it was masks, full PPE. So masks, you've got gowns and you've got gloves, and that was per patient. So you do have to take them out and hand wash so many times. And we had specific disinfectant that we use, like Avogard is one of them that hospitals use for the day-to-day temperature check. So we actually have screening at the front door. So reception, we had screening at reception. So I had one of my staff stand outside with a little table, thermometer, some gloves, and a mask on her face, and asking the questions as well. So we had to ask, of course, the typical questions, which is, do you have you been in contact with someone COVID? Have you been overseas or interstate? Do you have cold and flu symptoms? And if it was a yes to any of the questions, we would not let them come into the clinic at all. Patients would wait outside. We would let the doctor notify the doctor. Doctor will come out and have a chat with the patient. And we were doing telehealth. So all the doctor's consultations were doing telehealth, CPAP clinic as well. So we used to do telehealth. We try to help patients online with the CPAP machines. Yes, a bit limited, but it was still doable. Would you like to know anything?
I do have a question.
Yeah, go ahead,
I would like to ask you, like, if in your career path, did you find any of your friends from, or your colleagues from university, or if they take the same path as you, or what was the difference? Because medical science, as you mentioned, has many things to do after that. So you chose this path about sleep. And how about the other ones? Like, can you just tell us a little bit about that?
Definitely. So majority of my colleague, or I must say uni friends, really what they done is once they were done with their degree at university, the very common pathway is a lot would go into education. So they would go into teaching. And then there were a lot that go into medicine. So if medicine is your goal, they would have to do the GAMSAT. The UMAT or the GAMSAT. The GAMSAT, after your university, it's GAMSAT. Straight after high school, they have to do the UMAT to get into sleep medicine. But those were the two main ones. Another one is they go and do physiotherapy or chiropractor. But even then, for a chiropractor, you are essentially a doctor. Because I do believe they do a PhD, but majority of them go into the Masters of Education. Yeah. And you can do a lot of things. Another thing that's very common is a lot of my Ps go into research. So they do their honours, go into research. They do pathology. They go into and do pathology or in the hematology department. And, it could be in a hospital, Dudley Ainley Moore, Laverty. It could be anything like that. It is very wide, which is good because you can choose whichever pathway you want. To be honest, the majority of them go into medicine. Some just stay as a scientist. Some do clinical trials is another one. Clinical trials for cystic fibrosis, clinical trials for trauma, could be clinical trials for anything, really. And that you'll have to know all the standards and be up to date with the accreditation standards, really. So those are the main ones, Carla, I think I must say.
Thank you.
I actually have a question, if you don't mind.
Yes.
I was just wondering, so you said you've worked in the private and the public sector. Was there any main differences or advantages that you found working in those different areas?
Definitely. So there is advantages and disadvantages for both. Working in a private, the advantage is that you get to go up in terms of position without a qualification. And another thing is, now depending on which company, because they're very different. Some private companies pay well in privates in comparison to governments, but in my field, the government pays more. So in a government, I guess the advantage would be security, being in a government, and you get a lot of the benefits. You get benefits working in a public system like salary packaging. And you get paid according to the award. Now, another good thing as well in a hospital is every year they increase your pay by a certain percentage. Not much, but you go up by levels. And they pay you based on your qualifications and based on your study of that particular position. So an example, when I was working as a respiratory scientist at Westmead, and say I done my master's in sleep, that wouldn't count that in the government because sleep is not in a respiratory field. If I've done a master's in respiratory, my pay grade would be higher because I've done masters for that position. Does that make sense? Now, respiratory and sleep do link in, but government, they're very, very picky. But with the private, wouldn't matter. I guess another thing as well with the private is you're very flexible with timing. Like it can be all over the place, all over the shop. So I think those are the main ones I would tell.
Okay, thank you.
No problem. Okay, Sylvia does have a question. Do you mind just telling me what do you study after medical science? So after medical science, Sylvia, I done and majored in anatomy and physiology. I studied the Masters of Sleep Medicine at University of Sydney. And I'm currently completing a diploma of leadership and management with the Wisdom Company here in Canberra. Any other questions, ladies?
So in your current role now as a manager, when you recruit for new employees, what do you look for? Do they have to have a degree, specification already, like further study, like how you did? So if they're applying for a scientist or a technician role, what kind of, I guess, skills and experience do you look for?
Okay. So now, because I work in a private, Canberra Sleep Clinic is a private sleep disorder centre or clinic, I must say, we ideally, I usually do take I usually do take staff or recruit staff that have anything in the science. Anything in the science. It could be Bachelor of Health Science, Bachelor of Science, Bachelor of Applied Science, Medical Science, Forensics, anything in the health and science field. I would even take in like public health, anything in the health field, or experience. If I get both, that's a bonus. But in my field, to be completely honest, none of my staff have sleep experience, unfortunately. It's such a limited and narrow field. Not one of my staff have a sleep medicine or even any experience in sleep. But what that means is that doesn't mean I can't take anybody who doesn't have a science degree. I can, it's just about training, but ideally I would prefer somebody just so they can have the basic understanding of what they're doing. Just a basic understanding. And I guess as well, like with training, we do train, like we train with technicians, for example, we do 4 weeks of training. So we do setup training with Gita, who's our analyst, who will do the training. And the last week will be with me. So I will be talking to you about CPAP therapy. And I'll also be talking to you, I'll be doing a little presentation for you as well. It's more educational. So Gita will be doing practical. I'll do more of the sleep medicine background, the educational points that you will need to know or benefit that it will benefit you to know in the long run. Did you work while studying? Yes, I did work. I did not stop working. And that's from Yum. And this is another advice, I guess I must say, is do not wait until you finish your degree to work, ladies. Start working from now. Work and study, yes, it can be difficult, but just prioritize your time. And believe me, it is for the better, because by the time you finish your degree, get your certificate, you'll have your certificate on your resume, but you'll have no work experience. And a lot of the companies, I know it doesn't make sense, but a lot of the companies look for experience. And at that time you'll be like, well, how can I have experience if nobody takes me? So always keep your eyes out, be open to opportunities. Do you have any recommendations as a student? Yes, in regards to work and studying, Yum?
Maybe they mean what can you work in while you study?
Oh, what you can work in. Okay, so for another thing that I did miss out on, actually, before getting my internship, I was working as a medical secretary for 3 years, and that I think I started when I was about 17. I was there for 3 years before getting my internship. So you can work as a medical secretary, you can work as a blood collector at pathology, you can work as a technician. It can be a sleep technician. They will teach you from scratch. Respiratory technician. You can be a tutor as well at university. And there are a lot of things. Another thing is disability. You can work, in a disability sector, public health sector. I guess trying to think of the main ones. That's right. So look, even if you can get a job in any retail or any restaurants, because all jobs, at the end of the day, there is customer service skills, communication. So you will definitely increase, you will gain a lot of the communication skills, interpersonal skills. You will build your network skills. Networking is very important in the health field. Very, very important. You have to be open and, both externally and internally. Even if you work at a restaurant, anything, any kind of skill, we look at it as a benefit. An example, one of my sleep clinical staff is a barista. He makes coffees during the night. So for me, okay, well, yes, there's an advantage. So the night shifts. So she's used to the night shift. That's availability there. And another advantage is she knows how to talk to customers. So definitely there's an advantage. So if you have somebody I have experience at Kmart and I have no experience, you go with the one that has experience. So anything, doesn't matter what you do, always good to take that on board. If you can find something straight away within your field, even better, that's a bonus. But if not, you can start from scratch. You're going to do baby steps. Take baby steps until you get there. Not a problem. Yeah, I guess another thing I look for example, as a manager is availability. That's very important. I guess as a sleep tech, we'll really encourage you all to give that a go. If you can get one in a hospital, even better. If not, even the private. Doesn't really matter, because that on your resume will bump you up a lot as is. Will give you so much experience. You'll be introduced to a whole new world that you wouldn't even know existed.
Maybe can you share any tips or advice on like preparing for interviews, for example?
Yes, so when it comes to interviews, look, it's really important, no matter how nervous you are, it's very important for you to feel confident. Before going into any interview, I would recommend you to research the company, know what the company's values are, and look at the services that they do, look at the products that they sell, because it's very important for you to tell the interviewer basically, or inform them that, yes, I know what you do. I've had a look at your website. And I guess another thing as well is the criteria. You want to answer the criteria. So you look at the position description or look at the criteria beforehand and prepare answers for yourself. And look, I used to do that. I used to sit there for hours preparing the most perfect answer. And you always back up your statements with an example, because they always look for that. And another one as well, I guess you can do is the STAR response, which I'm sure you all know of, is you tell them the situation of that you're in, the task of what it is, and then and how you actioned it. And after that, you of course would tell them what the result is. So they'll always look at that, and that really tells them that you're a critical thinker and that you're able to problem solve. You're able to problem solve things on your own, and that is another big bonus as well for interviews. And always and be persistent. There's nothing wrong with being persistent. If anything, that will stand out to them. And always at the end also ask questions. Never not ask questions. You always do have to ask. I guess another thing as well is don't the do's and the don'ts. So the don'ts is you don't ask for the pay rate. No, they will do that on their own, and of course you have the option to accept that or not. Sorry, another question. Looking into a master's of audiology next year. That's a good one, Ruby. I was wondering if you knew piece of medical science. Okay, Ruby. Well, I don't have any friends that actually went into that. I haven't got any peers, or I don't know any colleagues that have actually gone into audiology, unfortunately. But it is a good one for medical science, yes. medical science is very broad, so you can definitely go and specialize into audiology, speech pathology. You can even go into like pediatrics. Like you can go into psychology from medical science. Like you can do anything, because it's so broad that it's not specialized. So you're not limiting your options there. You know, so you can really choose any way you want. And if you know anybody, Ruby, that has that experience, you know, and you're really interested, then I will definitely encourage you to do the Masters of Audiology. Is your Masters with experience? Do they give you experience, or is it just purely theory?
Samo, there's also another question from Sylvia. Was sleep science always the field you wanted to get into, or did it just happen?
No, I did not know that sleep science is, I didn't even know that it existed. I never knew what sleep apnea was. I never knew that sleep apnea disorder was even a thing. It just happened. So to be honest, all I did was just leave my opportunities open, and I went with it. But I maintained it. And I enjoyed it. Look, I had experience in respiratory and sleep. Why did I choose to master in sleep? Because I had more of a passion towards sleep than I did to respiratory. And sleep, I found it more challenging, and I like something that challenges me. With the respiratory, you get to a stage where you know a lot of things already. And it can be repetition because you're doing routine testing. Same thing for every patient. But no, I did not know. So don't worry. If you do not know what you want to do, it is very normal. Very, very normal. You will not know until you start your experiences, or you hear of something, your research, say, oh, that sounds interesting. So you can go from pathology to criminology. I mean, you can do anything. Medical science is very, very broad.
Yeah, and I think the good thing is, like Samo mentioned, is try and get some work experience, whether it's unpaid, if it has to be, just to navigate and see if that is the field of your interest before you, I guess, commit and spend more time specializing in it. You could do work experience, you could do internship opportunities. Sometimes you can even try through mentoring. Like you could, if you have an area of interest, you could pair with a mentor who is specialized in that area, and have a chat to them. What's it like working in that field? And from that, you might be able to gauge whether that's something you want to go into or not.
Yeah, definitely. I think, Ruby, you should go for it. And if not, if you can work as a secretary, as a first job in an audiology center, again, go for it, because it's you putting your foot in the door. It's baby steps, because when you're working in there, you've already got the networks, you've got the internal networks, and then word of mouth, they can give you a job. You know, like, yeah, not a problem.